According to an article published in Mayo Clinic Proceedings on COVID-19 related stress and work intentions in sample of US healthcare workers, 1 in 5 physicians actually consider quitting their jobs in 2 years, while 1 in 3 really consider reducing the amount of work hours they have in 12 months. Well, as long as I really relate to the concerns of people who are who really want to quit their jobs, I want us to consider this major thing. Is it not better to step back, take a break, rather than quit completely? Well, now let's look at the problems, look at the reasons why so many persons would want to quit medicine. Well, number one can be because of compensations from their work. Well, I know some hospitals don't have fundings, and they have like problems paying their staffs more or rewarding their staffs in good amount. There's problem with work-life balance. Well, being a doctor, you have to work, work, work. I know it's very, it's something that people really would want to contemplate. People want to like have fun. People want to like hang out with friends. The work-life balance is something that many people are really concerned about. Let's look at also parenthood and work. Yeah, well, being a parent, being a doctor can be two compelling things, right? So it is kind of like difficult. So it is a concern for most people as well. And what about relationships with colleagues? Relationships with colleagues and staffs can be also another problem. There can be conflicting situations, conflicting relationships at work hours, during work, where you work, and all that. And also, the one of the reasons I consider, well, so many medical students, many physicians quit is the number of years in practice. Sometimes, just like I said earlier on, that it requires huge amount of years to really study to become a doctor, right? So when you consider these years, oh, you think it's, I think, am I doing the right thing? Is it not better I quit rather than just go ahead? And talk about anxiety and depression. Well, I can remember that during my first year of medical practice, well, I remember that one thing I had was anxiety. So as time went on, I actually like felt normal. I overcame my anxiety, and today I am very, very proud to be where I am today. So talking about anxiety and depression, it can be another factor people quit medicine or quit practice as a whole. Talk about fear of infection. I know I've had like a couple of friends who say, oh no, I'm not going to become a doctor because I think I'm scared of having infections. I can remember during COVID-19, I had colleagues who had to quit working because of the influx, the rate of infection that was going on at that time. Now, after looking at these concerns, I would advise us to like, okay, take a moment and really look into some other aspects. Okay, now if you have concerns of over quitting, why not look for a colleague, talk to somebody about before you quit. Okay, you can go for counseling, meet somebody, so you can get some advice on whether to quit or not. Okay, you to talk about some very important stuff that might be troubling you. And what about in times of burnout? Well, if you if you know you've been stressed at work, if you know that you're having problem staying focused because you're stressed, okay, stress can be a very, very tough thing. It can be very, very tough for for our minds, right? So I think it is better for you to take a very short, you can take a break, okay? Take a break and then continue practice, right? You can take a break and then continue practice. So, and what about working in toxic environments? If you feel you're working in a very conflicting environment, you're having a very conflicting situation, relationship with your boss, with your chief consultant, with your director, with your colleagues, why not leave and go to a place where you're welcomed, okay? A place where you feel you would have a peace of mind, okay? Rather than being stuck in that same situation over and over again. Now, we have highlighted some of the concerns people really have when they think of quitting medicine. Now let's talk about why you shouldn't quit medicine, right? So the concerns, I talked about the concerns, and now let's talk about why you shouldn't quit medicine. You shouldn't quit medicine because it is rewarding. Well, why is medicine rewarding now? So I know in some other places, in most places, there are healthcare institutions that really provide good financial stimuli to their employees, right? To physicians. So I think you shouldn't be discouraged. You should fight, you should work hard to be among the best, to work in top jobs, right? So in this case, you have to attain the maximum skills so that you can receive a maximum reward, okay? The maximum reward you want. So it is a rewarding profession. Never give up. And also, what about sort of things like being a respected profession, right? So wherever you go, definitely people respect doctors, okay? If you're a doctor anywhere, whether you go anywhere to the remote villages and you tell them you're a doctor, well, people, you're respected because they know that you have put a huge amount of work in your practice, okay? So people respect doctors. And what about being a stable profession? Well, it is a stable profession because I think there are so many specialties. Once you become a doctor, there's so many specialties you can choose from, okay? After you graduate from medical school, you can choose either being a pediatrics, you can choose it either being a neurology, a radiologist. Okay, there's so many specialties you can choose from. And what about working in public health? Okay, so if you graduate, if you after you graduate from medical school, you can think of going directly into public health, or you can, as a physician, go into public health, take some course, go into public health. And also, what about also working in also you can work in alternatively related jobs as well, okay? Like a physician, a consultant, you can work in, as a physician, you can work in medical education and others as well. Now, my advice to ministries, institutions, agencies is this: try to make funding a priority, okay? I think if you are a private enterprise and you want to go into healthcare, make sure that your hospital is well funded, because when your hospital is well funded, you can be able to manage the concerns of your employees. It's very important. And also creating a supportive environment, okay? A supporting environment for your employees is very important. When you don't create a very supportive environment for your employees, what happens? Some of them quit, okay, along the line. Some of them just give up. Some of them feel depressed, okay? It's very important for you to create a very important, a supportive environment for your employees. Yeah. So this is it for today, guys. Thank you for listening to my presentation. I really want you guys to subscribe to my YouTube channel, because there are a whole lot of things, a whole lot of information that I will be willing to pass on to you guys. So please stay tuned and don't forget to subscribe. Thank you and goodbye.